A 44-year-old male came with a history of getting crushed his right upper limb, as you can see in this image, in a railway track by a moving train. He was brought to an emergency casualty room to the hospital, but the patient was conscious with a tachycardia, hypotension. What type of injury it is? The type of injury we have to mention, and how the patient should be managed in the casualty, and what are the complications associated with this injury we have to discuss. Now first, the type of injury is crush injury. You can see there is a tachycardia because of heavy blood loss causes hypovolumic shock. Because the patient got auto amputated because of his accident under the railway track, this limb, upper limb, got auto amputated. Auto amputed. Next, coming for the second question, management in the casualty. Immediate rescutation, that is ABC, we have to follow: airway, breathing and circulation. 2 wide bore cannulas are passed in a suitable veins in order to infuse the fluid, because this he may undergo get into hypovolumic shock. So we have to rescue him by immediately infusing wide bore cannulas where fluid is flushed rapidly. After, we have to draw a bit blood for investigations, then fluid is infused into the veins. Then oxygen of 10 to 15 liters flow is started. 15 liters is started. Blood should be arranged, but we have to send blood for the blood grouping. Before that we have to infuse the fluid. C for ABC. Then blood of the patients should be arranged. Then patient is assessed for hemodynamic stability by seeing the pulse rate, oxygen saturation, and breathing rate, respiratory rate and all those. Then Foley's catheter is passed. Antibiotics should be started because this wound is contaminated. As this is a crush injury, this wound is contaminated, so we have to start antibiotic therapy after that. Then anti-tetanus, because tetanus is acquired through road traffic road traffic accident, and this wound is contaminated, so there is more chance that he will be prone for tetanus. So anti-tetanus tetanus toxoid should be injected. Then that is tetanus toxoid immunoglobulin should be started. Anti-gas gangrene, there is a chances of Clostridium perfringens also, so we have to give anti-gas gangrene serum. Tetanus toxoid injections are given. Critical care zone, we have to keep him in a critical care zone and then monitor him properly. Then coming for the last question, complications. This is how you monitor the patient in the casualty. Coming for the complications associated with this road traffic accident, this is a crush syndrome. Complications in crush syndrome are rare. Complications of crush syndrome are renal failure, toxemia, septicemia, as the bacteria enters into the blood and the bacteria start releasing toxics, gas gangrene because of Clostridium perfringens, then disseminated intravascular coagulopathy, DIC. Then other important complications like compartment syndrome. Not in this case, but in road traffic accident you will be getting compartment syndrome, wherein intra-compartment pressure in compartment syndrome where intra-compartment pressure will be more than 30 mm of Hg, causing pallor, pulselessness. These are the signs for compartment syndrome. Pain, paresthesia, diffuse swelling and cold limb, which needs to be emergency adequate fasciotomy we had to do in order to treat the compartment syndrome. That immediately we had to do. These are the signs for compartment syndrome. Pain is an absolute sign because it appears as soon as there is a compartment syndrome, whereas the paresthesia will appear very late. This is all about the case. For more cases and more such videos, please do like, share, subscribe to my channel. If you have any suggestions, let me know in the comment section. Thank you.